Welcome to our channel. Today we're diving deep into understanding depression, a common and complex mental health disorder. You know, in my line of work I've seen firsthand the devastating impact depression can have on individuals and their loved ones. It can feel like you're trapped in a dark hole, unable to see a way out. But let me tell you something, depression is not a sign of weakness. It's a real medical condition, just like heart disease or diabetes. And just like any other medical condition, it's treatable. Over the next few minutes, we're going to break down the stigma surrounding depression and provide you with practical information and resources to help yourself or someone you care about. This isn't about sugarcoating anything. We're going to get real, honest, and straight to the point. Depression can manifest in many ways. It's not a one-size-fits-all deal. Common signs include persistent sadness and emptiness, loss of interest in things you used to love, changes in sleep patterns and fatigue. Reach out for help if you experience these symptoms. Don't try to tough it out on your own. Now, just like there are different types of cars, there are different types of depression, and each one has its own set of characteristics and challenges. One of the most common types is major depressive disorder, or MDD. Now, folks with MDD experience those intense feelings of sadness and hopelessness that we talked about earlier, and it can really interfere with their daily life. Then you got persistent depressive disorder, or PDD. This type is like a low-grade depression that sticks around for a long time. We're talking 2 years or more. And let's not forget about postpartum depression, which affects women after they give birth. It's a real thing, and it's important for new moms to know that they're not alone and there's help available. The bottom line is, understanding the different types of depression is essential for getting the right diagnosis and treatment. So, what causes depression? Well, it's not always a simple answer. It's usually a complex combination of factors. Genetics can play a role. If depression runs in your family, you might be more susceptible to it. Then there's brain chemistry. Imbalances in certain chemicals in the brain, like serotonin and dopamine, can contribute to depression. Life events, both big and small, can also trigger depression. Things like job loss, the death of a loved one, or even a relationship breakup can hit us hard. Medical conditions like thyroid disorders or chronic pain can also increase the risk of depression. And we can't forget about substance abuse. Drugs and alcohol can mess with your brain chemistry and make you more vulnerable to depression. The key takeaway here is that depression is often multifactorial, meaning there's no single cause. Let's talk about tackling depression head-on. Reach out for professional help. A therapist can provide tools and support. Medication can be part of the plan, especially in severe cases. Antidepressants help regulate brain chemicals. Therapy like CBT is effective for depression. Lifestyle changes like exercise and diet matter. Find what works for you and be patient. Look, depression can make you feel like you're drowning, but remember this, you are not alone. Millions of people have walked this path before you, and they've come out stronger on the other side. Remember, depression is not a sign of weakness, and seeking help is the first step towards recovery. If you or someone you know is struggling with depression, reach out to a mental health professional or a crisis hotline for support. Thank you for watching, and don't forget to like, share, and subscribe for more informative content. We're in this together.